Hello,
Welcome to Purana Talk.
we're the Purana guys. That's Alan. I'm Leon.
This is, as I said, the Garuda Purana, one of the 18 Mahapuranas of ancient Indian Hindu tradition. We're in a long section, part of the first skanda or section of the Garuda Purana, nearing the end of the first section. It's gone on for quite a while. We run into a series of chapters on diseases. Mostly not treatment so much as symptoms and recognizing diseases and seeing what causes them, particularly in terms of the Ayurvedic doshas. So there's my brief intro this morning. Chapter 159. Dhanvantari said, I shall now explain the pathology of pramehas, diabetes. Please listen, O Sushruta. Diabetes consists of 20 varieties. 10 are caused by kapha.
I want the name or the word they're using for diabetes.
Okay, that's pramehas, so P-R-A-M-E, pramehas, H-A-S. It's all one word.
Okay, thank you.
And it is saying that there's 20 kinds and half of them are caused by kapha. So kapha is the dominant cause. 6 are caused by pitta, 4 are caused by vayu. So, if you're a vayu dominant type, you are less likely to have disease than if you're a pitta. And if you're pitta, you're less likely to succumb to diabetes than if you're kapha. Now, if you look at the body types and things associated with the doshas, kaphas are often considered people that are especially solid or heavy of stature. And vayus tend to be
Skinny and
tall and skinny is typical, but vayus, because vayus are wind, they can blow either way. Sometimes the extreme goes the other way. Little people, especially tight little skinny people, can be very strongly vayu also. Pittas tend to be in between, Mr. In between, and kapha is more mucus, pitta is more wet heat, vayu is more cold, dry air. You can think of these things, and I could blather for a while, but let's go back. This is the first stanza of chapter 159. I shall now explain the pathology of pramehas. Please listen, O Sushruta. Diabetes consists of 20 varieties. 10 are caused by kapha, 6 are caused by pitta, and 4 are caused by vayu. Fat, urine, and phlegm are the seats of disorders.
That's an interesting concept, isn't it?
So of these disorders, so I think what you're looking at, fat and phlegm in particular would be associated with kapha. Urinary tract issues are often associated with pitta. However, because urine travels, there's a vayu element too. So I can sort of see how they reflect that. If you look at fat, urine, and phlegm, half your issues are going to be kapha things, a little bit vayu. Anyway, let's do 2 and see how long it takes to get through this. A patient of Haridrameha passes hot feces and urine having the color of turmeric and smelling like, it says saw flesh, but I suspect it means raw flesh.
Yeah, I think you're
right. It's typeset and it's from India and could be raw flesh. A patient of Manjishta Meha. So these all are some kind of meha or mehas. And it tells me now that the pramehas that we've been focusing on is really just an anglicized plural of prameha, because all of these don't have an S on the end. Only that one has an S on the end, and you can't tell in transliteration.
all right. Got it.
If it's a pluralized.
I corrected my entry. And so in 2, we have the first named meha, second meha.
Yeah, these are particular sub-mehas, if you will. There's the pramehas, and then there's Haridra meha. Okay, Haridra is, I just recognized that word because it comes out to be haldi. This is turmeric. It's turmeric meha, and it was just telling us that he passes hot feces and urine having the color of turmeric.
Mm-hmm.
And the patient of manjishta meha, I'm not quite sure what that would be, passes urine like the water with which Indian madder is washed,
So
which
red.
is a yellowish red.
Yellowish red.
We're going red. Manjishta. All I could think it was manj. Well, I don't know. 3. A patient of Rakta Meha. Now, Rakta is red. Rakta is like blood. Meha discharges flesh-smelling, hot, saline, red urine. A patient of Vasa Meha frequently discharges urine mixed with fat and having the color of fat. Blech. We're in 4. A patient of Majja Meha passes urine charged with marrow and resembling marrow. A patient of Hasti Meha discharges a continuous copious flow of urine containing slimy mucus matter. A patient of Madhu Meha discharges urine like honey. Madhu. Remember mead and mud?
Mm-hmm.
Sweet. It is of 2 types. So if you have honey Meha, your pee is like honey, but there's 2 types. When the vayu gets aggravated due to deficiency of dhatus, elements, and its path, dhatus has a specific meaning in Ayurveda. When the vayu gets aggravated due to deficiency of dhatus and its path is obstructed by the doshas, the patient begins to exhibit the symptoms, and without any apparent reason, he shows signs of amelioration and aggravation by turns. It then becomes incurable. All pramehas neglected at the outset turn into madhu meha in course of time. So they all turn into honey meha, huh?
Mm-hmm.
All those cases of prameha where the excretions are sweet like honey can be classified under madhu meha.
Yeah, well, it's the kidneys trying to get rid of the sugar.
Yeah. And this is diabetes. And it's 10. The common disorders of the pramehas caused by kapha are indigestion, non-relish for food, vomiting, somnolence, cough, and catarrh.
That's verse 10.
Yes. So the kapha half of the diabetes symptomology that it's laying out here is indicated by this characteristic of indigestion, not wanting to eat, vomiting, somnolence, sleeplessness.
No, sleeping. Passing out.
Excessive sleeping.
See, if you're
cough and catarrh.
You go into coma, basically. Really sleeping.
11. The characteristic symptoms in meha caused by deranged pitta are pricking pain in the bladder and urethra, bursting of the scrotum.
Ow.
Seriously? Fever, burning sensation in the body, thirst, sour eructations, epilepsy, and loose bowels. 12. Vayu-afflicted person exhibits the following symptoms: udavarta, prolapsus of the anus, shivering, pain in the heart, morbid longing, parenthetically, for bitter and astringent foodstuffs, colic, sleeplessness, withering up, dyspnea, and cough. These are vayu afflicted.
Mm-hmm.
Which are the less common types. The 10 types of abscesses caused by the neglect of prameha are: 1. Sarvavika, 2. Kachapika, 3. Jwalini, 4. Vinata, 5. Alaji, 6. Masurika, 7. Sarshapika, 8. Putrini, 9. Vidarika, and 10. Vidradhi. 14. The main cause is foodstuff. Sweet, sour, saline, oily, heavily lubricious, and cold in combination with kapha. All the things that aggravate kapha, that's what it sounds like. Newly harvested.
Well, it is true that almost, the whole sugar train is based on this alcohol, sugar, starch combination. Like, if you eat any of those things, it's going to go to the same place. It's just about how long it takes.
It spells sweet as sweat. 14. The main cause of foodstuff. Sweat, sour, saline. That reminds me of a little moment with Thundercloud years ago.
Yes.
When we cracked each other up for no good reason. But
punch drunk.
All right.
Okay, and we're doing chapter 1.
We're in 159. He's going on to another page in his notes. So, all right, we've just read the 10 types of abscesses, all in Sanskrit. That was enlightening. 14, the fact that you shouldn't eat these foods in combination with kapha. I would say that means if you're a kapha type or suffer from kapha weakness or aggravation of kapha in the system, you should avoid things that are particularly sweet, sour, salty, oily, heavy, lubricious, and cold. Kaphas need to be heated up. They need to be dried out. They don't need to be given salt that's going to cause retention of moisture. They're not going to give them oil and things that are going to slow them down. These are all unkapha-like things. 15. Newly harvested grains, wine, dal, soup, gravy, jaggery, and milk products in excess cause sharing the bed or seat as a patient may also cause the same. All right. That was interesting in syntax. Newly harvested grains, wine, dal, soup, gravy, jaggery, and milk products in excess cause sharing the bed
I'm not sure
or seat as a patient may also cause the same.
I don't know quite what they're getting at there. But grain, that's on the sugar train. Wine is too. Dal is too.
Soup, gravy, sugar against sweet. Milk.
These are all things with sugar in them. Or with sugar result, anyway.
Yeah.
So I think that's what they're getting at, is that they're recognizing the sugar train.
Sharing a bed or seat is...
I'm not quite sure what that means or what it meant to them. 16.
The defiled kapha located in the urinary bladder first defiles the body. Secretions like sweat and the fat and flesh, period. So first defiles the body, secretions like sweat and the fat and flesh. I think that's a list. Mm-hmm. Then it produces pramehas, which is your diabetes. 17. The kapha makes the blood mixed with urine. When kapha, etc. are exhausted, when kapha subsides, vayu brings the dhatus to the bladder. The curability or otherwise and the necessity to wait in the case of pramehas shall be decided by understanding the underlying cause. If the doshas are eliminated, the disease can be cured. If they are aggravated, the sickness persists. The general characteristic of all pramehas is copious urination, turbid in nature. By the combination of doshas, different disorders are observed. The different types of prameha are classified according to the color of the urine. The patient of udakameha, polyuria, passes clear, copious, cool, odorless urine like water. It is slightly lubricious and turbid. 21-22. The patient of ikshumeha, ik is sugarcane, so listen to this, discharges excessively sweet urine like sugarcane juice. The patient of sandrameha, parenthetically, chyluria or chyluria, chyluria, passes thick urine resembling state rice gruel. Stale, perhaps?
Yeah, perhaps.
I think the proofreader was drunk. 23. It's a theory. Or,
Well, it's hard when you're picking type.
oh God, I'm sure. I'm sure.
Get it perfect every
I
time.
suspect there's a good reason. It's not good enough. 23. The patient of Sura Meha passes urine like wine. Sura would be wine. Transparent at the surface but leaving a sediment at the bottom. The patient of Pishta Meha passes copious urine white like pasted rice. He has horripilation at the time of urination. Well, I cannot blame him. 24. The patient of Shukra Meha, spermatoria, again,
Mhm.
passes Yun, I think it must be one, passes, oh, I bet it's urine. They just left out the R and the I.
Yeah.
Passes urine highly charged with semen resembling it in color. The patient of Sikata Meha passes urine with sediments like grains of sand. 25. The patient of Shita Meha passes copious urine, cold and sweet, and Shital is like cold, cool. The patient of Shanair Meha passes urine slowly in broken jets. The patient of Lala Meha passes slimy, shreddy urine like saliva. The patient of Kshara Meha passes urine alkaline in character, in smell, color, taste, and touch. The patient of Nila Meha, blue Meha, passes bluish urine, and the patient of Kala Meha passes urine black like ink. Abscesses, usually occurring in vulnerable joints and fleshy portions of the body. An abscess elevated at the extremities and dipped in the center, produces no discharges nor giving any pain, is called Sharavika, since it resembles a saucer in shape. 28. An abscess giving a burning sensation and resembling the back of a tortoise shall be known as Kachapika. Kacha is the tortoise by scholars. The abscess, large in size and blue in color, is called Vinata. At the time of its incubation, the abscess Jwalini gives excruciating pain and a burning sensation. The abscess Alaji is terrible. It is either red or white and is surrounded by blisters. 30. An abscess resembling a Masura dal in modern Hindi, which is like an Egyptian red lentil. If it's got its skin, it's like a brown lentil, a little smaller if it's the Indian variety. An abscess resembling a masur dal is called masurika. Small clusters of abscesses resembling mustard seeds in the tongue are called sarshapika. They are very painful. They suppurate too. 31. The abscess putrini is of various sizes. Some are large, some small, some very minute. The abscess vidarika is hard and round like the bulbous root of vidari, an esculent tuber. 32. An abscess with the characteristics of vidradi, parenthetically erysipelas, Erysipelas, if you want to look it up. Here called vidradi. The abscess is called vidradika. So if it has the characteristics of the vidradi, it is called vidradika. The abscesses putrini and vidarika give intolerable pain and are fatty. Many other abscesses occurring suddenly due to deranged pitta are less fatty. Their virulence is in accordance with the aggravation of the doshas. In a patient of defiled fat, these abscesses occur even without prameha. They are not recognized as long as the color is not clearly developed. So are these abscesses typical of diabetes? Is this an accurate, they call this diabetes. Are they really looking at diabetes or?
I think, well, you have to remember what they're really looking at is the symptomology of what we call diabetes. And they're not looking at it quite the same way. So
right.
I think what you're looking at here is kidney disease that comes about because of diabetes.
Right.
They're using a lot of urinalysis. by looking at it, tasting it, things like that, smelling it, they're getting ideas about what's wrong.
Now, I know there's circulatory issues that can lead to very severe, results of people losing their limbs and stuff. Are these related to some of these abscesses they're talking about?
I'm not entirely sure what the abscess references are talking about, other than things like I say, kidney disease and because you get urinary stones and stuff like that from it. And if you'll remember, they actually talked about that in that other section on urine problems, and so they mentioned diabetes relating to that.
Yeah.
So I think they.
Well, this is all grouped under that ultimate head, and the Mayha's thing seems to be
right.
a symptomology of diabetes, but we've sort of left the Mayha's in a way, haven't we? When we started talking about abscesses, I haven't seen that.
Yeah, well, that started,
but it's coming back.
Verse 28.
It's coming back in 34. So,
and it told us that there were 10 kinds. I think
20.
It was.
There's 20 kinds.
10 types of abscess. Verse 13.
Oh, 10 types of abscess. Yes.
Yeah. So they're going through the 10 types of abscess. Just before that, they went through the different urine appearances.
Right.
And they went through them in the same order that we saw in verse 4.
Okay. Well, let's wrap this up.
Okay.
I'm going to go back to 33 and get a run at it.
Sure.
Many other abscesses occurring suddenly due to deranged pitta are less fatty. Their virulence is in accordance with the aggravation of the doshas. In a patient of defiled fat, these abscesses occur even without prameha. They are not recognized as long as the color is not clearly developed. Without the characteristic symptoms of prameha, if a patient passes urine red in color or resembling the washings of turmeric, he is a victim of rakta pitta, which it says is urethral hemorrhage.
I think this is when you get cut by a stone as it comes out. What?
35.
35.
And 36, 37. Perspiration, foul smell in the limbs, lassitude and looseness of the limbs, inclination to lie down, sleep, or take food, burning sensation in the chest, eyes, tongue, and ears, thickness of the tips, hair, and nails, and the profuse growth, fondness for cool things, parchedness in the throat and palate, taste of sweetness in the mouth, burning sensation in hands and feet. All these are the symptoms indicating the onset of prameha.
Diabetic nerve pain.
Yeah.
What verse is that?
36, 37. But it ends with the strangest sentence, and we'll finish it.
Okay.
Ants move about in the urine of the patient.
Maybe they're attracted to it because of the sugar.
Oh, I see. Maybe after you pee. I thought I was thinking like they crawled up the urethra or something.
Well, they pee outside usually, so this
people,
is why.
Yes.
Yeah, people.
And you might find ants around it.
Right.
Yeah, well, that's the sweetness again. 38. Thirst and sweetness of urine and similar disorders of various forms occur when the illness progresses. When the symptoms are full, the type occurs. When the other doshas subside, the vataja type may occur. Prameha caused by pitta and kapha exhibits the entire symptoms simultaneously, and that caused by sexual indulgence exhibits them gradually. Pittaja prameha can be checked or alleviated. If the prameha is not fully developed, it can be cured.
Catch it in time and do something about it. And that tends to be true, I think, with diabetes in many cases, unless it's
so a lot of these are considered very early symptoms before it's fully developed.
Yeah, I think what this doesn't take into account is that sometimes, the whole system that deals with this goes bad somehow. Yeah. Like you can have the mechanisms go off the rails, and if that happens, it isn't necessarily correctable.
Not necessarily.
Right.
So thanks for joining us, and see you next time.